Timps are the modern solution for a loose denture. Timps fix the denture in a definitive way, also in cases of an alveolar ridge resorption in an upper or lower jaw. Timp is a registered trademark of the Smile and Bite Enterprises. Dr. Wolfgang Forstner, dentist in Burgau, Germany, is going to demonstrate how a loose denture of a young man is held in place in only one session with Timps and can be used immediately. The height of the patient's mandible is totally reduced and in bad conditions. Consequently, the denture has no point of support, not even relaxing. Already a minimal chewing movement makes it move up and down and left and right. Like unfortunately many contemporaneous, this man is not able to chew correctly. His chronicle appearing stomachache is just one of the consequences. With little blue plates, the doctor previously anesthesiates the spots of injection. A normal injection, you hardly realize it, is enough to place the minimal screws composed of a titanium alloy, absolutely painless. Naturally, the doctor has measured previously the lower jaw meticulously in an X-ray device. The lengths of the direction of the timps are fixed before being introduced in the lower jawbone. The ideal spots found in the X-ray for the timps are marked by the doctor on the gums of the patient. In emergency surgery, screws similar to timps are used successfully for many years. Back to the intervention. The orifices of the timps are microscopic. The diameter is 1 mm and the length from 5 to 10 mm depending on the requirement. With one word, they represent no risk at all for the patient. As the timps leave no injuries, there are no secondary effects or problems like bleeding, retarded healing, scares or other. Normally there is no need of stitches either. Timps cannot be compared with traditional implants. Every dentist who has taken part in a timp workshop can easily implant timps with traditional tools. It is to say, you do not need necessarily a specialist. Such an easy treatment with so little risk is called in medical terms minimal invasive. Our patient has already his first timp. The dentist checks the stability, there is no blood, no pain. This fact makes the timp so ideal for difficult patients. In the meantime, the patient denture is being prepared to receive the basis for the so-called O-rings. The denture is perforated to create the necessary space. In most of the cases, the existing denture can be used perfectly well. This fact reduces considerably the expenses. Dr. Forstner implants always 6 timps if possible. Thus, the pressure of the denture is shared and minimized on all 6. The neck of the timps consists of little rubber rings introduced in the metal housings called O-rings. When the denture is placed, these rings hold the tops of the timps, and this is the secret of the tight fixing. But there is a little space for movement that allows the lower jaw gums, they too are elastic, to adjust to the hard body of the denture. The O-ring can be gradually adjusted to the requirements of the patient, from soft to strong. Infarct or rheumatism patients usually need soft graduations. The self-hardening plastic material is ready, and so are the bases for the O-rings. They are exactly where they should be. The polished and overhauled denture is checked once more by the doctor in order to assure the stability and perfect collocation. The spots of possible friction are corrected, but that is unavoidable.
Mal zubeißen. Tack, 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 so.
The original situation, the dance of the denture. The actual situation after 1 or 2 hours at the doctor's. Perfect, stable situation. The stability of the timps naturally depends on the stability of the bone and is measured electronically and subsequently documented. The success of lasting of the timps is more or less the same as of traditional implants. It is around the 95%, which seen from a medical point of view is an excellent result. Another patient who with little effort and in very little time has recovered his quality of life and his self-security. That is the joy of life on earth, although for the doctor, his patient is happy and laughing without fear. For people with denture problems, it's to say incompatibility, the timps are a real great help. In the United States, the dentists are using timps successfully since 1978 for the well-being of their patients.